Skin cancer is a big problem in South Florida, but now there's a safe, painless, non-invasive way to treat non-melanoma skin cancer. Here's Dr. Jason Green. Dr. Green, good to see you.
Thank you very much for having me.
All right, so you're doing something very exciting in your practice that not many doctors down here are doing, SRT. Tell us about it.
It's an amazing new technique now. It's a procedure that we offer for patients with skin cancers, non-melanoma skin cancers, basal cell and squamous cell, to remove their skin cancer without cutting, without pain, without surgery, without any downtime, and no scarring. That's the most amazing aspect of the whole thing.
It's incredible. And is this a fairly new technology?
This is technology that they had from years ago that they actually transformed into a superficial radiotherapy, which is a technique to remove the skin cancer through denaturing the cells of the cancer. So it's all technology created into new technology, so yes.
Because you walk around South Florida and you just see scars everywhere from people that have had various forms of skin cancer. How does it work? So you've explained it a bit, but physically the patient comes in, what happens?
So it's a very simple process. Basically, the patients come in for less than 30-second procedures. It takes me longer to set up the patient in the chair than to actually do the procedure. However, it's not a one-time deal. It's usually anywhere from 12 to 15 treatments. And it's a process that we're getting rid of their skin cancer through 30-second treatments.
That's unreal. Now, okay, so it's not melanoma, we've established that, but how do you make sure that it's all gone? I mean, are there tests for levels of stuff?
So that's the first question I had when I started researching this machine. This machine actually, you can actually see the cancer physically going away, getting smaller and smaller and smaller, and eventually you see nothing there. And there's physicists that actually work on this process that through equations have shown the amount of radiotherapy that actually can denature the cells and actually make this cancer go away. So when the process is done, there's nothing left. That's why there's no cancer, there's no scarring. It's an amazing technique where there's no pain. It's pretty awesome.
It is remarkable. That's a game changer.
Game changer. I actually had a basal cell carcinoma, which is the most common type of skin cancer, on the tip of my nose. And I had surgery. I had this procedure called Mohs surgery. And then I had to have a plastic surgeon do the closure on my surgery. So I went through the pain of the surgery. I had to get stitches. I had to have a scar. I was red on my face for like 6 months. And I have a scar. It shows. I wish this was out there years ago. And it wasn't, but now it is. And so I want to offer it to all my patients or anyone who has skin cancer.
Wow, incredible. All right, so when you're not doing that, you also have some other really neat, more cosmetic things at your practice as well, right?
So we do everything from general dermatology, including the skin cancers, to the cosmetics. And the cosmetics are the fun part, to make people look pretty and keep people looking younger, and people want to look younger. So one of the new things that we're doing is called Kybella. Kybella are injections for underneath the neck to get rid of what's called submental fat of the double chin. And that's pretty amazing because it's not only used there, but it's also used off-label for the lower abdomen. So instead of freezing or doing machines that take an hour to treat, you can do it in 5 minutes to get rid of that fat.
Yeah.
Another thing we're doing is called Bellafill, which is a filler. We've been doing fillers for years, but a lot of the fillers last only about a year at the most. This new filler lasts 5 years. It's FDA approved for 5 years. So it's pretty awesome. It's also game-changing in the filler market goes.
Fantastic. All right, and there's even more. We're out of time. So if people want to get more information and they want to come see you, they want to learn about sunscreens, I know we were going to talk about that as well. How can people reach out to you?
People can call me at the office at 954-481-0650 or drgreenderm.com.
All right, well, great to see you, and we'll have you come back. Maybe as we get closer to summer, we can have you back to talk about sunscreens.
It would be my pleasure. Thank you very much.
You got it, of course.